Hello, Assalamu alaikum, good evening, and welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Okay, today we have brought to you a unique topic, a topic in which we are going to discuss the challenges, the health challenges of the modern woman of today. You know, how have things changed? How have lifestyles changed? How have things changed around us in the environment, ourselves as well? And what impact are they making to a woman? So, you know, what does she have to be mindful of? And for that, we have with us in our studios Dr. Tahmeena Rahman, who is an obstetrician and gynecologist and a teacher as well. So thank you very much for joining us again.
Thank you for having me.
Okay. Tahmeena, you know, to get the topic clear to people who are watching the program today, what is the difference between the challenges that the woman of today is facing as, you know, compared to, say, a couple of decades earlier? So what do we actually mean when we're discussing today's program?
Yeah, I think it's a very broad topic. The woman's roles in life of any woman nowadays, she may be a student, she may be a working mom, she may be a single mom, she may be a homemaker. But in all the roles, the stresses in her life have increased, the demands on her time have increased, and the de-stressors have decreased. You see, the events, say a stay-at-home mom, when they come to me and they say, I ask them what they do, what do you do? Say, just a housewife. Say, oh my God.
That's the most difficult job.
Yeah, you are a homemaker. So, what is different in her life from a woman 20 years ago? Yeah, she has to be the tutor. She's the mother, the cook. She may be looking after a staff, or she may be running the household alone, depending where she is. But she has the responsibilities.
And it might be an extended family where she has more family members to look after.
Exactly.
There may be elderly people.
She has that role is the traditional one. But now she's the tutor. See the competition in the schools?
Oh, crazy.
The stress.
Yeah.
She's the driver.
Stressful as enough.
Yeah, she has schedules of extracurricular activities and tuitions and all that to run. And a lot of times young moms are not able to afford drivers. And if you are having drivers, you still have to be involved, right?
Yes.
So the demands on her time. And then each person in the household is no longer living, you're not eating together. You're not at the table together.
Yeah.
The meal requirements are different. The timings
That
are
is so
different.
true.
She has to cater to so many different needs. And the social life, it's different now. It's not the relaxing social life that used to be there, sitting out in the evening.
What's changed there?
I think it's more intense and purpose-driven. And
More
not
competitive.
relaxed. More competitive, just as everything else.
In fact, more than, you know, you'd think you'd be going out or socializing to relax.
No.
You actually find that, you know, you come back with a bit of more of a luggage that you took out in the first place.
And this comes, even their kitty parties
Yeah.
are competitive. It's all very intense, right? So the woman who's a stay-at-home mom, I think, is even more stressed than the working lady or the working single mom, or even, you know why? Because everyone
She's
says,
not being recognized.
Yes. What are you doing?
Yeah, she's not being recognized.
Not at all.
So she actually is doing such an important
Absolutely.
role and playing she's basically holding the house together,
Yes.
right? And she also is not giving herself enough credit, is she?
Oh my God, yes, yes. That is another thing. However modern a woman may be, she may be again working or whatever, there's a traditional mindset that a lot of issues that are women's health related are taken as fate, something that they have to live with, right? And they have to accept it. For example, incontinence after childbirth, there's so much we can do to help them, they don't even come to us. Menopause, it's supposed to be, you know, a transition.
Yeah.
That they have to accept and live with all the hot flashes and everything, and they don't think they deserve to go and get help on that matter.
Priority.
They don't come. Yes.
It's all about priority.
Yes.
Whereas, you know, she has to realize how important she is. I mean, all the, you know, housewives and homemakers that are listening to this program, you know, you deserve a huge salute for doing something. Again, that is, maybe people are not registering. And in fact, you will see this, that when the actually the woman in the family gets ill, everything falls apart.
Absolutely. She has to get out of bed for a million things. She's not pampered in bed. She can't be.
Everything falls apart. So that's where she should realize how important she is. And then
Pivotal.
women in our society, unfortunately, we have ourselves to blame though as well, Damina, because what we usually do is we have this mindset where we'll be putting the children first, putting the husband first, other family members first, and knowing we have an issue that we have to deal with, but not going to the doctor.
Not going to the doctor. It is so sad. There is so much we can do to improve the quality of life of so many women. And because their issues are not addressed in time, they become problems that then subsequently may require huge interventions, right? There are things that we can help them with earlier on.
True.
But it's a matter of awareness. A woman, a stay-at-home mom, has to firstly be aware that she is stressed. People ask me, why is stress becoming so important? Problems used to be there before. What is the big deal about stress nowadays? It's not that the problems may be different now, but I think stress has increased because the pressures are from too many directions. We've just spoken of this direction. I mean, there's a whole other world of the digital pressures and digital media and all that. But it's the processing of stress. The de-stressors are not there.
Which is so important.
Exactly.
Which is so important.
What used to be, if you remember the times of our mums and all, what used to be the de-stressors? They used to hang out together, do simple things together without competitiveness. The physical activities, going to the movies.
The simple things.
The simple things.
The little things meant a lot.
They really took them far. They actually were able to talk to each other. People don't talk to each other anymore.
No time.
No time.
Or even if you sit together, you have two people looking at a screen.
Here I have to disagree. See, you can have two people sitting together reading books as well, which used to happen decades ago. But they at least, when they would at times at least sit together. Now, because of the shortage of time, that is taken as a wasteful moment, right? When we were small, we would sit at our home, and each one would be reading their own book. We didn't have the digital things.
Right.
Remember our childhoods? We had books.
Yes.
I don't think
and a
that,
beautiful part of childhood.
Yes, because I don't blame the digital media, but it's that we've stopped making the effort to communicate.
That is so important.
We have stopped making time.
Yeah.
We don't unwind with each other. We meet because of purpose. We meet because of an angle. We meet because we are competing, because we have these, whatever may be happening.
Right.
But we are no longer engaging with friends just to hang out, to have a laugh.
We're not giving ourselves quality time.
Hobbies are gone.
Yeah.
Who has hobbies nowadays?
Yeah. People will think you're crazy if you have a hobby.
Yeah.
They'll say, how can you find the time to have a hobby?
Those were
Why
the biggest
wouldn't you?
de-stressors. They are
So
no
true.
longer there.
So true.
No one has any hobbies. No one does.
Women used to knit, crochet,
Working with your hands. That's
embroidery.
gone. That's gone.
Yeah, that's true. And imagine the satisfaction of creativity and creation.
This is the de-stressor.
So true. Okay, so we spoke here about the why the woman of today is facing the different challenges that are impacting her health. Okay, let's talk right now. Let's start with the student, the woman who's a student. What are going to be her issues?
All right. So in different roles, the different kinds of stresses, we, as a student would have the pressure of the high grades, the competitiveness, the social isolation. They're not, the kids don't go and play games anymore. They don't hang out and have a laugh anymore. They're just competing. And any free time is just spent on social media. They don't find that time to engage with other people. I think that a more important thing to understand vis-a-vis the student is that is the time that a very common problem now first rears its head, the polycystic ovarian syndrome, right?
Okay.
Because I'm bringing it up here because it's to do with stress has a role to play,
Okay.
right? What you have genetically is one thing. Your environment comes into play. The environment is your sleep cycle, your diet, the way you process stress. Now, mind you, not
Okay.
every sibling with the same genetics is going to have the same health issues.
Right. True.
Your diet and the way you process stress.
Okay.
Do you internalize? Do you keep fretting? Do you keep processing? You may be externally all happy and vibrant, but you are reprocessing the same thing, hashing the same thing.
What is the correct way of processing stress then?
That's another show.
Okay.
I think a psychologist would be in a better position to really explain it technically, but basically, for me, as when I counsel my patients, I tell them the first step is identifying that you need to you need to do better at it.
Okay.
Right? And before I can have any, this process will not start having an effect until they understand it. So what I explain to them is, how does stress impact you? Imagine the brain, and then there's a center for all the hormones in the center. So it's surrounded by all this brain tissue. Any short circuiting in the brain tissue is going to impact that center.
Okay.
It's going to release all these hormones and precursors and all, and they're going to impact every single cell of your body, right?
Imagine.
So
It's going to send you everything haywire.
Yes. So the process, that's oversimplified, but you see the
Right.
concept.
Yeah. Okay.
What goes on here affects everything. Your
Everything.
thyroid, your other hormones, your female hormones, everything is affected. So if a person understands that this is how important it is for me to deal with stress, then they start figuring it out. I tell them, all right, take a deep breath and see how you're dealing with stress. If you're overthinking something and you're not able to get out of that loop, maybe then you should go for counseling.
Okay.
But get hobbies, get friends, all the things that are missing. Try
Be
those
closer to
first.
nature. That's something as well.
I think people have forgotten what nature is outside.
Outside
screen.
a screen. That's
Yeah.
true. Okay. Okay. Now we're talking about young girls, students, or even if they've sort of like finished studying at the moment. You spoke about social media. Now, social media has this filtered image of people, and especially young girls, are doing the comparison thing on social media. So what they're doing is they're looking at a certain image and they're thinking, oh, this is the preferred image of today. This is how I should be. So then diets and all those different diets out there, how are those wreaking havoc?
As far as weight control is concerned, I'm all for diet management. Not the fat diets, but managing your diet. You don't need to, these are huge lifestyle changes. The lifestyle changes we talked about, you mentioned digital media. The digital media, as far as time consumption is concerned, or sitting to work, doing research or anything, it's fantastic. I wish we had these aids when we were students. But then where it comes and affects every bit of your life, and your likes determine your state of mind, then that becomes a bit, that's a stressor.
Okay, right. So, as we said, the pressures have changed. So the main thing is to sort of like understand that you have to like yourself first.
Yeah, agreed. But to like yourself, if there's something you don't like about yourself, for whatever reason, there are ways to fix it in a positive way so that it makes you feel good about yourself. But the expectations have to be realistic.
That's true.
So what the ideal has to be realistic, what you want to achieve. let the girls have their dietary plans. Let them have exercise plans. Let them join the gym. Let them do the positive stuff for themselves, right? Because that is important for all these hormonal disorders. We need to have healthy diets. Our diets are not just the fast food and the carb-rich ones that are the culprits here with the obesity epidemic. It's also that even our soils are deficient. Our soil is deficient in the basic elements because of all the chemical that we put in the soil, right? The fertilizers are all chemical.
Right.
They're not natural. So manganese, magnesium, zinc, they don't go into the soil. So they don't come into that, the
plants.
vegetables and the
Yeah.
plants that the animals eat. They're just out of your food chain.
Okay.
So,
imagine this.
so multivitamins do become important because of this reason. It's not that
Right.
you can't get the multivitamins. There's some that are missing in a regular diet. So it's a balance. The diet has to be balanced, and it's not just the proteins and the carbs. It just has different types of foods at different times. I think communication will improve the ideals that the children or the young women strive for, because they are in isolation, just looking at that screen and deciding the ideal
Right.
without the social engagement, without
True.
the social support or the social acceptance of who they are at that time.
Which is so important.
They are not doing
So
that.
important. Okay. Now, the working woman, whether she's a mother or not a mother, well, if she's a mother, then of course everything else is much more intensified upon her. Tell us about her and how she is juggling career and home and maybe children,
Yeah, tough, very
maybe an extensive family, and you know, what's happening there?
tough. A lot of single moms.
We are going to discuss that separately.
The
single
whole
mothers.
working
Yeah.
mother, she again, I think what it boils down to is that the modern woman has so many different aspects to her life crammed into the same 24 hours that the woman decades ago had. But she has so much more that she needs to provide and do with that same time, and leaves very little time for herself. At the end of the day, it's this. It comes back to the processing of the day-to-day stresses. She has different stresses from the homemaker and from the single student.
Yes.
But
Of
why
course.
is not every single working woman collapsing and becoming hormone disordered? Right? Each one has a different genetic predisposition,
Right.
and each one has a different way of processing the information. So the stress, some people actually have the method of taking an issue, thinking about it, solving it, not solving it, putting in a box mentally and putting it away. Those are the ones who deal with the successfully with the stress. But not the ones who keep thinking, okay, should I have done that? Should I have done this? Should I? Those are
Oh
the-
dear, I'm placing myself in a category.
most of us most often are in that category, and then you'll see that it would have had some health impact.
Oh, definitely, definitely. When you tell a person who is a person who worries all the time not to worry, it just doesn't make any sense.
No,
You're not responding to it because you're thinking, okay, you know, a person tells you not to worry or not to think about the same thing over and over again. Then what am I going to do?
How do I stop? How do I
How do you
stop?
stop? Yeah.
Again, the first steps are acknowledgement, and the last step for me, for my patients, is when I send them for counseling. In between, I try to be their mentor, their counselor. Individually, I look after at their issues, their triggers, their method, how I can help them manage it. To the extent that my expertise allows me to. But then there comes a point that they may need to go to people who are really truly experts in the field, which I prefer to send my patients to psychologists, because I'm a great believer in counseling and learning the techniques to manage your stress.
Rather than going to medications.
No, I'm quite averse to that.
Right.
I want people to have lifetime solutions, not temporary ones.
Right. What about her hormonal issues? Because she may be getting ready to have a family, she may be pregnant or trying to get pregnant. Fertility as well.
Fertility is affected. Definitely, again, comes to the stress, the hormones.
Stress is sort of like the common denominator.
For me,
Yeah.
my personal journey in life as a doctor, I have seen this denominator.
Mm.
I have actually seen it work,
Mm.
where I have helped them with their stress management.
Mm.
They became pregnant, their polycystic ovaries started resolving, they were able to lose weight finally, they were able to, to get their life in order. And so many of my patients then would come back and tell me their stories, and like that's for me, the sense of accomplishment has been amazing. But dealing with stress is not easy, certainly. Your point that when you tell a patient to stop stressing,
Yeah. It's
it's like, I don't
you've
just
hit
say
a
that.
brick wall, you
No,
know.
would if I didn't get engaged. And I engage with my patients.
Yes, yes.
I am available to them.
That's
Then they come
definitely
back
true.
to me, and sometimes just for counseling. I become not just their gynecologist, I'm their
friend as well.
friend.
Yeah,
Yeah.
that's fantastic quality in any doctor, and I wish more doctors would employ this method.
I think most doctors do want to. It's a time issue. When you engage so much, the empathy is also taxing for a doctor.
Yeah,
If
true.
you get so involved, most of the psychologists themselves go for therapy.
Imagine, you know, I always thought of that.
Yeah.
To listen to so much happening.
Yeah.
How do you deal with that?
Where they are required to go for. They don't choose to. They are required to go for counseling. That's how. So the more a doctor is empathetic with the patients, the more it's
Vulnerable.
the toll is very high.
Yeah,
You
the
get
more
so
vulnerable as
involved and so
well.
invested that
Right.
it is very difficult.
Okay.
So yeah.
Okay, another thing. The working woman has, you know, as we just described, multiple roles going on. She has to decide somewhere where she has to let something go as well, doesn't she? I mean, it's also...
She shouldn't be so hard on herself.
Yeah.
She has to understand that she may have multiple roles, but she doesn't have to be perfect at every one of them.
That is the main thing.
She doesn't have to. She can actually let go. She should actually decide, all right, if there is my child is with me and I can take him to the park, do I really need to stay and do my cupboard, my wardrobe today? Leave it. You know, just choose, prioritize, and be kind to yourself.
Kind to yourself. Oh, that is so important.
Just don't aim for perfection in every aspect of your life.
Yeah, because
No.
that's impossible.
Impossible, and these are the stresses, the impossible goals, the impossible ideals, the impossible dreams. You dream, but then you have to be realistic about how you implement them.
Absolutely true. Okay. Let's talk now about the single mother. Unfortunately, this is a situation that, you know, we're seeing a lot more of in Pakistan, as say, you know, a couple of decades ago.
Yeah.
Things have changed, dynamics have changed, awareness, you know, there are many, many factors. You can't put it down to one thing. So as a result of that, we have a lot more women who are single mothers. It makes life just so much more challenging for them. What should they be doing? How should they be looking after their health? And what are the main issues that they face?
I think the main issue is that they are the ones who are actually the most neglectful of their selves. Each category that we've discussed does that to an extent because of the social, cultural, traditional flavor to our lives. But I think these ladies are actually the ones that absolutely do not take care of themselves. They would not, and also the single mom has more financial constraints as well, more time constraints as well.
Oh yes.
It's not just that
It's a matter of survival for many.
Yes,
of them.
and it's even if she wishes to, unless she has a tremendous amount of support from family, the extended family. Those in the West who are bringing up children as single moms, I mean, my hats off to them. They are the ones who are absolutely doing everything with no support, and they have to understand one thing. For me, if you ask me to give one advice to these ladies or anyone in that, address your problems when they start. One visit to the doctor at the right time. just get the help at the right time before it becomes a huge issue that takes you away from work and family and hospitalizes
True.
you.
And again, that will give you a double whammy, because then you're not being able to go to work.
Yeah.
So there comes your financial trouble, and then you have huge bills to pay.
Yeah, yeah, yeah.
So
So you're not really doing anyone a favor
yeah,
by being sacrificial.
I love that. Yeah,
Don't have to have
You
that
don't.
mantle of the sacrificial lamb all the time.
Yeah.
Stop.
Be intelligent.
Be intelligent. Be kind to yourself.
Be smart.
Yes, this thing that, you know, I have done everything for my children and now my health is like that. Why that mantle of sacrificial lamb? That's not needed
Yeah.
and not
And
appreciated.
that will also sort of like negatively affect your relationship with your children, won't
They
it?
don't appreciate it. The answer most women get is, we didn't ask you to do this for us,
True,
mom.
true.
We didn't ask you not to take care of yourself.
True.
Yeah.
And in fact, you are looking after your children by taking care of yourself. You're doing them the biggest service there.
Let's see, those women, when we're talking about women not taking care of themselves, my one issue, one area that upsets me greatly is the perimenopausal women.
Oh, right. That is a very important topic.
Actually, it's because our lifespans have increased. A lot of our lives, women's lives are spent after menopause. How can you not take care of yourself at that time?
Can you please explain to our viewers what menopause and perimenopause is?
So perimenopause is the time where all the hormonal changes and the physical issues leading up to the menopause can start. It can be up to 5-6 years even. And the menopause is when the periods actually have stopped and remain stopped for a year. That's when we label the patient menopausal. It can be often around 50-52 years of age,
Okay.
but it can be sooner, later.
That's the menopause or the perimenopause?
The menopause.
Okay.
The menopause
Right.
is that, but the perimenopause can start 5-6-7 years before.
Right, okay.
So a woman
How
can
will
start,
a woman know?
Yeah, she can start having an irregular cycle. She can start having occasional flushes and occasional sweating and inexplicable kind of things happening. And she can understand that the body is now changing and slowly her ovaries are shutting down,
Right.
heading to the complete stoppage. Once she hits menopause, then she's deprived of estrogen, she's deprived of the progesterone. It leads to the biggest issue. Everyone has heard of osteoporosis, right? But the biggest favor you can do for yourself is to look after yourself at this stage.
Right.
There is a great fear of hormone replacement therapy in women. They do not think that they should be going for hormone replacement therapy.
Okay.
It is strongly recommended to initiate hormone replacement therapy for the hot flushes and all once they are severe enough, and then continue till at least 60 years of age. If you want your the osteoporosis to be mitigated, and you want, because estrogen is the one that helps in the calcium deposition in the bones, right?
Okay.
If a person is diagnosed with osteoporosis at 60, can she start hormone replacement therapy? No.
Okay.
No purpose.
All right.
You have to start
Before.
at around 50, 52. You start even before the menopause hits you. The patient is supposed to start it when she starts experiencing the hot flushes and the vasomotor symptoms.
So why so much resistance to the HRT? Is it because of the side effects, or the various things?
A lot of misinformation.
Right.
There was a huge study, Women's Health Initiative study. There was a bit of skewed data and analysis. So there was a bit of, the conclusions were not really technically correct, and some of them have been debunked later. Now let's talk about the recommendations from we follow the British Royal College, the Royal College of Gynecologists and Obstetricians. We follow their guidelines.
Okay.
So the guideline is that unless strongly contraindicated, every woman should be offered hormone replacement therapy for the vasomotor symptoms, right? And to prevent osteoporosis, right?
Okay.
The risk of breast cancer was exaggerated.
Uh-huh.
The risk of heart disease was exaggerated. It does not start till if a woman continues HRT after 60 years of age, then there may be a slight increased risk, but that's just negligible.
Right.
And the breast cancer risk is very slightly increased, and that too not in women who are properly screened and monitored. It's
Okay.
not sufficiently increased not to take the benefits of these hormones.
Right.
All the gynecologists I know take the hormone replacement therapy.
Right.
And I find the strongest resistance from the educated women.
Uh-huh.
And
And is that again because of the Googling?
yeah, that here, this has been bad.
Okay.
They
Right.
their quality of life can be so great.
Uh-huh.
The mood swings.
The mood swings.
Oh my God.
Tell us about those in
They're
menopause.
terrible. They're constant.
Are they
And
the
they're
same as being pregnant, or are they
different.
different? Okay.
Different. Though those are too many of the hormones, especially progesterone. Here, it's the deficiencies of the hormones and these.
So what mood swings is a woman on perimenopause or menopause?
They
what
look
should
like they seem like depression to a lot of people,
Okay.
and then and that a lot of time for menopausal symptoms, antidepressants are given, whereas HRT would maybe do a better job.
Because
Right.
then you're going to the root of the.
Yeah, for as long as, see, if someone is still having some mood issues after 60 years of age, you can stop the HRT and switch to the antidepressants.
Okay.
But while they are working, and while they keep the skin healthy, they keep the hair healthy, there are so many other advantages to it.
Okay.
So the hormone replacement therapy is actually underutilized by our ladies, unfortunately, and they, for
Again, because of the misinformation.
there the lack of information or the bad information online
Right.
is greatly to blame. And can you imagine that the requirement for hormone replacement therapy in Pakistan is so little that I am unable to prescribe those medicines because they're not available in the market. I actually tell my patients to buy separate medicines, cut them up, big pill boxes, and have them because they're not available in the proper form.
Because of the demand,
There's
lack
no
of demand.
Yeah.
Okay.
They did come to the market, but then they were removed because no one was prescribing them. And another problem is that looking after the women, our society generally treats women as baby-making machines,
That's so sad.
and that's all they are taken to the doctor for.
That's very, very sad.
True.
Yeah.
And all the other issues,
So then now she's not useful that way.
so her other female issues are not dealt with. She's not taken to the doctor. She doesn't herself think that she needs to go to a doctor. She deals with so much of this stuff just like that, just because she thinks that's her fate. She should go to the doctor. She should get help. She should have proper quality of life.
So, you know, here we have a common situation where we have children, grown-up children, who, you know, always are complaining that their mother is so moody or irritable or angry or whatever. I mean, you have to look for the cause there, and it would be better if the children sat down and spoke to their mother as well, you know. Maybe this is, you need to see a doctor, you need to go and get some
Talk to a
treatment.
moody mother. Tell her to go to a doctor. Seriously, you think they'll survive that?
It's the same formula as a pregnant wife, isn't it?
Yeah. You tell your mom to go to the doctor for another reason, but do not speak of bad
You have
mood.
to be very tactful. But again, that is such an important issue, because then that is actually eating away at the social fabric at
Yes,
home as well, isn't it?
yes,
It's
yes.
damaging the relationships.
The whole household, people draw apart. The children are already moving away to colleges and universities, or have moved away, and they don't want to visit anymore.
And they're saying because, you know, mum is always complaining.
Yes, and
she's never happy.
Exactly. The whole quality of life is gone. They're not forced to engage, because joint families, they were forced to engage. Here, they have the choice. They don't visit. The parents are sitting alone and not talking to each other.
Yeah, that's terrible.
Because
Whereas for the mother, if you look at it from her point of view, she spent her time, you know, having her children, giving her all, bringing them up. And at that time, now, when she's at menopause, she just needs a little bit more understanding, really.
Absolutely.
And a sort of a recognition and an acknowledgement that, you know, okay, maybe if children just sat down and said, okay, you know, really acknowledge and we understand and we embrace all the things you've done for us.
Yes, I think, and that's a good start.
Isn't it? Because then she will sort of, because really she's asking for that, isn't she? She wants that acknowledgement.
My suggestion,
Yeah.
bring your mom to the doctor for osteoporosis prevention. Don't talk about the mood, but do bring her to the doctor.
Good advice.
do bring her to the doctor. At least you have a reason for her to visit, and then all the issues can be addressed by the doctor. But please, please look after yourself at this age. It is so important.
That is so true. Okay. You know, again, as we've been saying, there are so many things going on that we just don't realize. The reason we don't realize is because we don't have priority in the right place.
Absolutely.
I mean, even when we sit down and talk together as family members, as friends, are we really addressing the issues that are concerning us 24/7? Do you know many of us leave the home to escape what's going on at home, whereas it would be better to address those issues, because these are very, very important issues, that the relationships, the family fabric, what's going on.
See, when we were talking about a homemaker, and when she told, I always tell them that the working women, me included, we have the advantage. All is forgiven. Our homes, the way, even the way the children are being brought up. The homemaker is under a microscope all the time.
Yeah.
She's the one who has no excuse.
What else are you doing?
Oh, why are your children not perfect with perfect scores, with perfect behavior? Why are you not perfect in perfect clothes, with perfect hair, kitchen, food, everything?
Yeah.
And they're under a microscope. A woman is forgiven. A working woman is forgiven a lot, actually. And but still. The lack of exercise, the lack of personal care, the lack of interest in one's own self, everything is put aside. And a working woman does it too. But then everyone has to get that balance. Everyone has to research things in the right way and find out about how to remain healthy. One thing I do, when patients come to me, I usually stop all their medicines. And then I tell them first to fix the things that are wrong in the way they're living their lives.
So
and
important.
only then I will treat them for anything. So I find that people don't drink more than 2 glasses of water in a day. In summers in Pakistan, how are you going to have good skin, no acne, or all of that if you're not having enough water? So I fix those little things. I fix their diet, I fix their hydration, I fix their stress. And 9 out of 10 times, I don't need to give them anything else.
Imagine.
I make sure that there is nothing else that needs to be treated first, nothing physical causing their problems. Once I've ruled that out, then I come to the fixing how they're living their lives. Then the third stage is a review, whereby I decide, now do they need anything? Most often they don't.
Imagine.
Most often even infertility issues. I address their lives, I address other things. They start relaxing, they get pregnant. You've heard about people adopting a child and getting pregnant soon after.
Yes.
What is that?
Yeah.
Stress, gone, and the patient is fertile again.
Because they're not obsessing about that.
And stress changes your immunity. There have been studies of cancer patients, the same kind of cancer or heart disease or anything, or white cells in infections. So those with support, that was decreasing their stress. Those without support, who were stressing alone.
So true.
And the healing was better. The cancer, the recovery from heart disease, from infections, everything is better. Every single part of your life is affected with the way stress is handled and internalized.
That's true. What is your advice to the men as well who are watching the program, that how they can contribute in having healthier female members in the family, be they mother, wife, sister, daughter? How can they contribute?
I think just being there, really being there, talking to them when they come up with a problem. Don't dismiss. Don't say, my mother also had this, or my mother also gave birth to a child, or my sister did this. Don't do that. She's one woman. She is a person. What her problems are hers. She talk to her. Understand. She may be your mother, sister, whoever she is. give them the time, give them the attention, and then take them if they need to go somewhere, if they need to see someone, don't be dismissive.
Yeah.
And be with them, especially with your wife. Be with her on her visits, even when she is not pregnant.
So true.
Understand what's happening with her. Because when she comes out and tells you the doctor said this and the doctor said that, you're not even trusting a word at times.
Right. Okay. Fantastic. Thank you so much, Dr. Tehmeen Naz, for being with us again. And again, a wonderful program full of so many facts and so many tips for everyone who's watching.
My pleasure. Thank you. Thank you.
Okay, and with that, we come to the end of today's program. You know, lots of knowledge, fantastic, pieces of advice that Dr. Tehmeena gave us, and everything does make a difference. Please prioritize yourself, look after yourself, stay happy, stay healthy. Bye-bye.